Children with special healthcare needs make up just 20% of the pediatric population, yet account for nearly half of all pediatric health spending, navigating a fragmented system that too often fails them. George Boghos, CEO of Imagine Pediatrics, is on a mission to change that. As a two-time founder with deep roots in pediatric care and healthcare investing, George brings both operational grit and genuine passion to this challenge. Under his leadership, Imagine Pediatrics has grown to serve more than 78,000 children across 8 states, delivering 24/7 virtual and in-home medical, behavioral, and social care through value-based partnerships. Join us to discover how this pioneering model is keeping kids out of the hospital, building caregiver confidence, and proving that aligning incentives around outcomes transforms lives. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, George. A big welcome to our podcast today. I'm so excited to have you on.
Thanks, Mike. Really excited to be here with you.
Well, given your extensive experience scaling innovative care models for underserved pediatric populations, as well as your passion for ensuring that every child with special healthcare needs receives the integrated, always-on care they deserve, I'm honored to have this important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn in order to further the conversations occurring on this podcast. All right, George, it's almost time for our community to learn how you and the Imagine Pediatrics team are pioneering 24/7 virtual and in-home care for children with special healthcare needs, now reaching more than 78,000 children across the country. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Mike, I would say it's important to be willing to take risk. Value-based care, risk-based models are how you align incentives around outcomes that matter to children and families. Real change requires stepping into accountability, not around it. Being willing to put your money where your mouth is and everything you're doing is very, very important to get that credibility and align outcomes with costs and win-win-win for patients, for payers, for providers, for the whole ecosystem.
Do you feel that the industry and kind of just where we are at as an industry, are we getting there? Are we, we've heard about this for a long time, George. You're smiling, I'm smiling, but smiling because it's like, oh my gosh, we've been talking about this for so long. Are we there yet?
We're getting there. I'm an optimist by nature, Mike. I think AI is going to be a huge part of how we get there. That's the good part. I think there's a carrot and a stick. The carrot is AI. The stick is the pressure going on in the ecosystem in the macro environment right now around budget cuts, around programs like Medicaid needing to be more efficient and align incentives better. So you get that pressure combined with the promise of AI and what it could do to really align and personalize care around what patients need, to me, is the way that we get to true value-based care.
And the team members that are in Imagine Pediatrics and the people that you serve, are their minds there as well? Like, hey, now is the time. Obviously, there's a lot of mission behind that as well. How are you feeling in regards to the lives that you touch every day, the team members that you work alongside? How are they feeling kind of culturally where we're at in this moment of time? Are they feeling that, hey, it is now about to happen as well?
I do feel that. I do. And that's what keeps me optimistic and excited about where we're going is patients understand the need for alignment of incentives down to the family level. They know the system is broken and fragmented. They know volume and templated care programs and pathways sound good, but are rinse and repeat for every patient, every child in our case, are not what works. What works is really personalized care aligned around outcomes. And my providers love it. The idea that a clinician can spend 2-3 hours with a family getting to know them at a very deep level We're not worried about doing 40 or 50 appointments a day just for the sake of doing 40 or 50 appointments a day. It's truly about knowing which patient needs the help right now and spending as much time as needed with that patient. And so my clinicians coming out of more traditional healthcare settings, in our case, out of the hospital setting, out of NICUs and PICUs, or private practice in pediatrics, really love the idea of the clinicians getting to do what they want to do, spend the time in a way that really drives outcomes for patients and families.
Well, and exciting realities of what you are seeing on the front lines with you, your clinicians, and of course, most importantly, the patients that you all serve. We're going to talk about how this all came to be in the first place, where you guys are today more in depth, and of course, where you're heading tomorrow. We're going to unpack all of this and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with George Boghos, CEO of Imagine Pediatrics. George, thank you so much for really setting the stage on the front end. An exciting time. Now is the time. We're starting to feel it. Your clinicians are giving you that feedback. Your patients are obviously experiencing exactly that, like you mentioned that just right before the commercial break, being able to not spend minutes, but sometimes spend hours with those patients. A total paradigm shift, and one that I personally think we are ready for in this country. And it is now time because of a lot of the macroeconomics and pressures that we're also experiencing. But of course, George, before we get into all of that, we got to discuss how this all came to be in the first place. You know, one of my other favorite cities, we talked about it before we hit record, Chicago is definitely one of my favorite. Another city that we talked about before we hit record was Nashville. We might want to talk a little bit about what happened there as well. A wonderful city, an incredible community over there. And of course, incredible music as well. And then we'll talk a little bit where you guys are today. How are things going in the marketplace? You already teased it just a bit on the front end. We'll get a little bit more in depth there. And then, of course, we got to look at a little future state. We'll pull that proverbial crystal ball off the shelf, talk a little bit about what you're seeing on the horizon, what we need to be kind of paying attention to. And of course, we can't let you out of here until we figure out a way or two to help you and the team out. But George, let's take it back. You know, let's go in the way back time machine. How did you get in healthcare in the first place? How did your passion come to be pediatric type of healthcare? Of course, how did Imagine Pediatrics come in focus as well? Give us a little bit of that backdrop before we kind of start diving into who exactly is Imagine Pediatrics. How did this all come to be in the first place with George Boghos being in healthcare?
Yeah, started right when I was born. So I was in some ways born into healthcare and pediatrics. Mike, my mother is a pediatrician, actually soon to be retiring here in a few weeks. But she's had a long career as a practicing pediatrician. And from my earliest memories are going to the clinic with her and watching her do what she does. So in some ways caught it from a very early age. I'm also, just like a lot of immigrant families, I'm an immigrant to this country and got beaten into my head that you should go be a doctor. And, you know, my mother was biased in that way. And yeah, started on that journey. I'd say I lasted about a semester in college until I realized that is not for me. But I'm so passionate about healthcare. I caught the bug and actually went to college in your second favorite city, which is Nashville, and being around the healthcare ecosystem there with the background, having grown up around pediatrics and healthcare, I got hooked. I started a little backwards, I would say. I started out sort of an advisory role right out of college and then doing some investing actually in growth equity for several years. What that let me do is just see a broad picture of the healthcare ecosystem across technology, services, providers, very wide spectrum of ideas and innovations happening in the marketplace, you know, early on in my career. And so that's where I started and then pivoted into being a founder. So I'm a two-time founder now. My first organization that I founded was called AIM Clinics. It was serving children with developmental disabilities, including autism, and really focused on bringing services, clinic-based outpatient services for children in underserved areas geographically. Having grown up in the Southeast, that's where we were focused in communities where children and families with developmental disabilities and autism had little to no resources and support. You got a diagnosis maybe of autism after waiting 2 years to get diagnosed. You get a report that says you have autism, and then it's good luck, go figure it out, see what the school can do for you. And that just didn't feel right for me. And our mission was, how do we go bring services to communities that had no access? So AIM Clinics was outpatient therapy, behavioral therapy, speech, occupational, physical therapy in those communities. And we're able to serve 25 different communities across the Southeast through that organization. And then that journey came to an end with AIM Clinics via a merger with a different organization. But I just loved the work of pediatrics. I loved serving underserved populations. I loved children with special needs. Just super meaningful work. It got you out of bed on those really tough days where building a startup, building a business, there are a lot of tough days where you just don't want to get out of bed. But the stories of bringing access to children to great services that really change their life trajectory that they wouldn't have otherwise is really what gets me out of bed in the morning. So I knew this is what I wanted to do, and luckily fell into Imagine Pediatrics as it was being created and joined the founding team very early to bring services in a very different way and care in a very, very different way for our most vulnerable children. Children with medical complexities and special healthcare needs who are navigating a very, very broken, fragmented system of care where we can really reimagine how care is delivered for those children and their families. And with Imagine, since before we launched the organization, about 4 years, we've been seeing patients for about 3.5 years today. So it's been a very, very fun journey, wild ride, really exciting, but just continue to be blessed to be able to do the work that I do serving the families that we get to serve.
An amazing journey thus far. And Mom, if you're tuning in, thank you for preparing George with all of those intimate moments where he got to see it on the front end as a youngster. This is just right after Mother's Day that we recorded this. So a post Happy Mother's Day to your mom. So we'll give her this podcast as maybe one of those special gifts. I love it. And incredible. And of course, happy retirement upcoming for her as well. Incredible. George, before we dive in and talk about, who exactly is Imagine Pediatrics and kind of what you guys are doing today and tomorrow, let's first set the stage a bit on a macro. What do these problems look like, for us as a nation here in the United States? Maybe define a little bit about how big this issue is, the brokenness, the disjointedness. Frame up how big of an issue this problem set is.
Yeah. So, Mike, there are about 14.5 million children with special healthcare needs in the United States. It's about 15 to 20% of all children in the US, but they account for north of 50% of spend on pediatrics in this country, right? So it's a population that is costly and has a lot of needs. But what really gets me is the fragmentation of the system. This is families. Think about children with complex, chronic, lifelong conditions, sometimes more than once at a time, more than one condition at a time, that are navigating multiple specialists. They've got a pediatrician, they've got the school, they've got an insurance company, they've got therapists, they've got pharmacy. They're sometimes on 3 or 4 different medications. They might have equipment needs that they're relying on to survive. You think about just the number of people involved in that child's care and that family's care ecosystem, and it's highly fragmented and doesn't talk to one another, generally speaking. And what that leads to is things fall through the cracks. You get families with literal binders. I've seen some of our caregivers with binders that are thousands of pages thick of care plans from one specialist or the other, to you get discharged from the hospital with here's how you care for your newly installed feeding tube. And who's going to keep up with that, right? It's just overwhelming for families. And what that leads to is an inordinate amount of time spent in the hospital and in the emergency room. When things fall through the cracks, when it's 2 a.m, and your feeding tube falls out, who do you call? And what do? You end up going into the emergency room, oftentimes getting admitted right away. And oh, by the way, as a country, it's It's not like we've got plenty of emergency room capacity for pediatrics, right? I'm sure you know this, Mike, but especially during COVID, a lot of the emergency room capacity that was pediatrics was converted to adult care, and not a lot of it has come back. So it's not like we've got capacity in these emergency rooms and hospitals for children. And so you're burdening an already burdened system, and you're just making the lives of caregivers really impossible to navigate. And so it's a huge, huge problem. It's a huge burden on families, and it affects not just the child, obviously, that's got the special needs and the parents or caregivers, but their siblings and their communities. So being able to think about healthcare differently for these families in a way that's tailored, that's personalized, that brings all of the system together in a way that's holistic, and keeping children out of the hospital on Christmas and Thanksgiving when they don't need to be is really our why. This is why we exist. This is what we're trying to do.
Well, that's a great segue, because now we want to talk about the what and the how. Imagine Pediatrics now almost approaching 4 years in and of itself is a huge feat and something to be celebrated. And so George, let's go there a bit today in its current state. Who is Imagine Pediatrics?
Yeah, Mike, Imagine Pediatrics is a virtual first and in-home medical group purpose-built to serve children with special healthcare needs. So it's a group that brings together a multidisciplinary team of clinicians, pediatrician-led, that includes nurses, it includes therapists, it includes social workers, it includes specialty care, it includes pharmacists, nutrition care, dietitians, psychiatrists, heavy emphasis on behavioral health, all coming together under one roof within Imagine Pediatrics, do holistically and multidisciplinary care for children, 24/7 integrated virtual and in-home care. It wraps all those medical, behavioral, and social care around children and their existing providers, right? We're working collaboratively with the specialists and the other providers with the whole goal of how do we, in a very high-touch, personalized way, reach these families, reduce preventable hospitalizations, build caregiver confidence, and create more safe days at home for our children.
An excellent overview, and really appreciate setting the stage on that as well, George. So let's talk about some specifics, the what and the hows, if you will, and all the wonderful things happening within the camp. You've already kind of talked about this a little bit on the front end just a moment ago, but one statistic that really stood out to me in preparing for this conversation is that 20% of children with special healthcare needs account for nearly half of all pediatric healthcare spending. What does it say about our current system that such a concentrated group of kids has historically been so underserved? And how does Imagine Pediatrics flip that equation?
Yeah. What it says about our system, again, it's a system that perhaps works well. Again, my mother's a pediatrician. I grew up around this. The idea of going to the pediatrician and seeing your pediatrician once or twice a year, and you're getting sick and you might call them and they meet your needs, that works well for kids who are generally healthy. For children that I'm talking about, children with chronic complex conditions, think about children who came out of the NICU, right? Who might be dependent on a piece of technology to survive, a ventilator or central line or feeding tube. It's children with developmental conditions, neuro conditions, cerebral palsy, cystic fibrosis, very severe asthma it's not very well managed. Oftentimes, 70% of the children we serve on top of these medical needs have at least one behavioral or mental health condition that just adds complexity to that structure. And you've got a lot of folks trying to manage that care, a lot of specialists that in a siloed way manage specific one condition or the other. But as a family, there's just a lot that falls through the cracks, right? And it's the problem of at 2 a.m, when something happens, who do you call and what do you do? And the answer is, unfortunately, you go to the emergency room, right? And so the way we're flipping that equation is our belief is that if you care for these children in a multidisciplinary, longitudinal way that's based on developing deep trust with their caregivers and their families via app that we've built in-house, where families are able to download it on their device. They're able to chat us 24/7, 365. We respond in under 2 minutes. We're able to get a pediatrician on the phone very quickly in an emergency situation. But what's more important is it's a very high-touch model where we're developing long, trusting relationships between specific care team members at Imagine and the family. We're educating them on their existing care plans. We're bringing siloed care plans from different providers together into one and really giving that caregiver confidence to manage the condition of the child, safely and effectively, right? So that's the virtual piece. And then the ability to go into the home as needed. We're able to think of it as a mobile urgent care that shows up in your home. And again, for a child who might be bedbound on a ventilator, it's not an easy thing to get in a car and go to urgent care. Right? So our ability to go in there, do diagnostics, do blood draws, lab draws, deliver medication, all of those things, really tries to catch things upstream instead of waiting until there's an emergency and we're going to the ER in the middle of the night and often getting admitted and all the things that come with that. The infections you might get in the hospital once you are admitted lead to readmissions and all those other things. And so our belief is if you bring really high touch integrated care to these families on the front end, and it's 24/7, it's integrated virtual in the home, you're really able to reduce that spending because we're not spending time in the hospital paying for a lot of those, unnecessary avoidable hospitalizations and ER visits. And you're improving outcomes and you have happy children and caregivers who are spending more safe days at home.
So let's also talk about kind of the business models, right? We discussed it on the front end here about risk, and then is the market there yet? We kind of half joked about it, but now in all seriousness, let's talk about the notion of partnerships and being able to work together in this marketplace. I've seen that in the past, you've spoken about what strong health plan partnerships could look like, including aligned on shared goals and building trust over time. From your perspective, George, what does it actually take to get a health plan to think differently about pediatric care? And what has surprised you about that process?
Yeah, look, I think the health plans that we work with really desire a solution to serve this population, right? This is historically an underserved population where there's not a lot of innovation that's happened. I mean, pediatrics generally is the last place innovation happens, unfortunately. And that's kind of the driving force and motivator for all of us at Imagine Pediatrics is coming in here and really thinking about care for peds differently. And we find that our health plan partners are very receptive to that. They know that the tools and the ecosystem they have is not fully meeting the needs of our children. That said, particularly in the current macro environment where there is budget pressures and spend is out of control across our healthcare ecosystem, specifically where we work primarily with Medicaid health plans and Medicaid families. There's an extreme desire to find things that align outcomes with reducing total cost of care, right? You got to do right by children and their families, but you also have to find a way to bend the cost curve. And so we find a lot of appetite around our model, which is we put our money where our mouth is, right? The only way Imagine is successful is we've got to really get in, deeply engage with families, and start driving real change and real outcomes. It's increasing safe days at home. It's reducing unnecessary hospitalizations and ED visits, driving down that total cost of care and creating, savings for our health plan partners. And again, healthier, happier families and kids. Very proud of our net promoter score from our families, which is a plus 87. It's my favorite statistic. So to be able to do that while at the same time bending the cost curve and creating real savings to the bottom lines of our health plan partners is sort of what we are here to do. And again, given the current environment and the pressure everybody in the healthcare ecosystem is feeling, there's a lot of desire for models like this that align payment with outcomes.
And you teed me up perfectly for another area that I wanted to touch on. It is exactly that. That NPS score of being above 87 is incredibly remarkable, especially when you talk about it in the pediatric space. And as a parent, I know how how difficult it can be at times to make sure that the parents are happy. So, and I say that half jokingly, but with a lot of seriousness as well. So let's talk a little culture there for a moment, George. Imagine Pediatrics, like I just mentioned, having an NPS above 87 among caregivers, which is remarkable signal of family trust. How do you and the team build and sustain a care culture across a multidisciplinary team that is consistently earns that kind of confidence from families under stress?
It's an amazing question. We've got 5 core values at Imagine Pediatrics. I'm going to share three of them with you that really, I think, speak to how we've been able to create a culture that puts families first and does the right thing always. Our first core value is children first. And that is what gets us going every single day as clinicians and other team members at Imagine. The idea that every decision we make is always in the best interest of the child and the family we're serving is frankly easy to do in a value-based care, risk-based model. There's never a question about, I got to do something just because I have to see volume, a specific number of visits today or whatever the case might be. I'm really doing what is in the best interest of the child. If I do that, the economics will take care of themselves, right? So there's never incentives are perfectly aligned within our care team. So that's one. The second value is what you mentioned. It's earn trust, right? A lot of our parents and caregivers are coming to us with a deep mistrust and distrust of the healthcare ecosystem, right? They've been burned by the fragmentation of it. They've been sometimes promised things that weren't delivered on. And the way we think about building trust is getting to know families and serving them holistically via social needs, behavioral needs, medical needs. We really value that very first interaction we have with our families. So when we enroll them in the program, they download our app. We do what's called a meet and greet visit with one of our care team members. And really, we're just asking what keeps you up at night as a parent. And the goal is whatever that thing is. Sometimes it's medical, sometimes it's behavioral, sometimes it's just social needs that our families are dealing with. How can we step in and solve that need for you? And if we're able to do that, solve that initial need, we get a lot of trust from our families. Say, okay, maybe this group is different and maybe I should trust and engage with this company, Imagine Pediatrics, differently. So it's that. And then a third value I'll speak about is one team, diverse perspectives. So I mentioned multidisciplinary nature. We call them care pods. It's our care teams that come together to care for a specific group of children. And it's got a social worker, and it's got a pediatrician, and it's got a therapist, and got a psychiatrist and nutrition and pharmacy all under one roof. Just really beautiful. We have these, pod huddles in the mornings. I get to sit on them sometimes. To see 10 different people with 10 different specialties coming in and talking about one individual patient and family with different perspectives that are really additive instead of siloed is really beautiful. And patients and families feel that. They feel like they've got a real team behind them of champions that's really caring for them in the right way, a way that's highly personalized, where incentives are perfectly aligned as well.
And let's talk a little future state as well, George. Obviously, we've been talking about it throughout this conversation. These are very difficult times. We are experiencing, emergency type of situations and scenarios in many of our communities across the nation. And one of those is pediatric units are closing across the country, and coordinated specialty care is becoming harder to access for many of the families that you and the team serve. Where do you see the Imagine Pediatrics model fitting into the broader future of pediatric healthcare in our country? And what would have to be true for that future to actually happen?
Yeah. Again, Mike, I mentioned I'm an optimist by nature. So I think the future is very bright, right? There is a real need recognized by all different constituents in the system, families, patients, payers, providers, to really do this differently for children with special healthcare needs. And, for us, the goal is to continue. Our outcomes have been amazing. In our first year of being operational, we, again, not only achieved plus 87 Net Promoter Score, we saved $65 million on total cost of care with 2 health plans, right? So the idea that you're able to take a very high spend population, make sure the caregivers are happy and satisfied, reduce hospitalizations, and bend the cost curve dramatically is something I'm very, very proud of. And with those results, our goal is to take that and continue expanding, Imagine across the country. Today we're in 8 states, just launched in Tennessee actually yesterday, which is our 8th market, and starting to see patients there. But we're looking to expand and bring Imagine Pediatrics and our, again, really innovative, unique care model to more and more families and children with special healthcare needs in the future.
Well, thank you for sharing that. Of course, we got to bring it back to current state as well. George, let's talk about how we, our community here rallied around this podcast, can be helping you and the team. What's one problem, need, or question that you and the Imagine Pediatrics team have that we can be helping you with?
This might be cliche, but the biggest thing on my mind, I mean, AI is all over, right? And separating, we're innovative in a lot of ways. We're using AI to do a lot of very smart risk stratification with the goal of like, how do we personalize care for each individual child? We have 78,000 children we're serving today. They're all very different. How can we take data that we get from our health plan partners and other third-party data and our own data to say what patients need what care at what time from what provider, right? So we've got that use case for AI. I'm curious there, again, with AI, there's a lot of like potentially hype, and then there's a lot of really good use cases that folks are putting in practice today to improve outcomes, to improve the efficiency of their teams, to make sure clinicians are practicing top of license. So, I could always use help and thought partnership from others around what's working, what AI tools or systems, and where in the organization has AI been helpful versus some other areas that it's not been as helpful and we should stay away from. So that's an area that's always kind of top of mind for me, is what are those tools that are really the highest ROI, when it comes to AI and other innovations in technology as well.
So for our listening community, there's a lot of them out there that are working on exactly this and are passionate about it. How does our community get a hold of you to have these discussions, social media handles, websites, or otherwise? How do they track you down online, George?
Yeah. So our website as an organization is www.imaginepediatrics.org. And then the best way to get a hold of me is probably LinkedIn. So George Boghos on LinkedIn. And I'd love to chat with any of your listeners around AI technology or anyone else innovating across healthcare and pediatrics.
And for our listening community, just simply scroll into the episode notes in the podcast player where you're accessing this episode. There are those contact points listed for George and the team. Or you can head over to our free global online community at passionatepioneers.com. There will be a post for George's episode where you can leave comments, feedback, suggestions, or otherwise, as well as find those contact points online for George and the team, again, over at passionatepioneers.com. George, what an incredible and exciting conversation, an important one as well, especially given all the things that we are dealing with across this nation as an industry. We need folks like you and organizations like Imagine Pediatrics now more than ever. So thank you for all that you're doing. But before we get you out of here, we do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
children with special healthcare needs deserve better.
I love it. I love it. George, thank you again for taking time to be with our community today. We know how busy you are building this incredible organization to serve almost 80,000 lives and growing, an incredible feat in and of itself. We're cheering you on. We can't wait to continue to follow the journey. But for now, and of course, thank you so much for taking time to be with our community today. We're wishing you and the team nothing but the best.
Thank you, Mike. It's been an honor being with you.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.